Hello, everybody. Hope to find everyone having a wonderful day. Thank you for joining the Healthcare Technology and Information Management Board of Governors exam tutorial today. Wanted to share a quote with you all in a moment, but before that, I wanted to say congratulations by attending this review course and seeking to earn the FACHE certification. You have taken the first step in demonstrating that you have a solid grounding in the principles of healthcare administration. So congrats for taking these first steps. And as Walt Disney said, the way to get started is to quit talking and begin doing. So let's begin. Quick introduction. My name is Sepi Browning. Just want to share my profile and my email address. If you are needing anything, please feel free to reach out. What is FACHE? I'm sure you've already had a little bit about this, but you're taking the next steps to distinguish yourself. FACHE is a professional certification program for healthcare administrative professionals. You distinguish yourself in an increasingly competitive marketplace, expand your career opportunities, validate your knowledge, competency, gain skills and tools to make a difference in our organization, in our community, demonstrate your commitment to our profession. Keep in mind, what this review course is not. This is not a prep course that will cover all areas that you might or potentially get tested on. It's not a preview of the test, and it's not a guarantee to help you pass the exam. What is it? It's helping you identify where your areas of opportunity are to study further. That's what it is to help you identify. How to prepare. Create a study schedule. Determine when you would like to take the exam and then plan your timeline. Perform your own independent research on areas that you identify to be your areas of opportunity or areas that you are not strong in. Create quality summary notes. Study those notes. Write the content from memory onto paper and then compare, or whatever tool that might help you study. Reach out and utilize. Determine which topic areas you're most comfortable on and which ones you might want to brush up on. Answer as many practice questions as you can and identify your areas of weakness. Focus on them. Add answers to incorrect questions to your summary notes. Determine how much time and effort to expand on studying each topic based on the relative weight of the topic area per the content outline in your experience. So if a category that is identified as a knowledge area on the exam, there's a lot more questions, it's an area that you need to brush up on, then you probably want to spend more time studying. Our agenda for this topic is some intros that we just did, trends in healthcare, strategic planning and information systems, and IS materials, some exam study guidelines, and when we do meet in person or on Zoom, we'll have some discussion as well. So FACHE Healthcare Technology and Information Management Exam Core Knowledge Area is, this area covers management information and clinical information systems, such as finding computer-based support for management, assessing how much or how current technologies and major innovations are changing the way healthcare executives manage, using information systems for short and long range planning, using clinical information systems and acquiring information systems. The knowledge area outline for information systems are to obtain the knowledge of the role and functions of information technology in business operations, knowledge of technology trends and clinical apps in healthcare organization, knowledge of technology policies and regulations, for example, complying to HIPAA security requirements, the HITECH Act meaningful use, that sort of information, knowledge of health informatics needed for operational decisions, data, equipment interoperability standards and support, knowledge of potential impacts and consequences of healthcare IT decision-making on staff and processes, whether it's in finance, operations, clinical areas, accounting, anywhere, and quality of care. Sorry, that bothers me. Here we go. Continuing on. Knowledge of information systems continuity. Example, disaster planning, recovery, backup, security, sabotage, natural disasters, anything related to cybersecurity as well. Knowledge of factors that influence selection, acquisition, and maintenance of IT systems. We're going to go over some terminology like upgrades, conversions, technical or technology life cycles, and knowledge of healthcare analytics. So what is health? By the World Health Organization, WHO, it is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. What is health information technology? HIT, or Health IT, is defined by the Health and Human Services Office of the National Coordinator for Health IT, otherwise known as ONC, as the application of information processing involving both computer hardware and software that deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge for communication and decision-making in healthcare. And what is health informatics? As defined by the U.S. National Library of Medicine, health informatics is the interdisciplinary study of the design, development, adoption, and application of IT-based innovations in healthcare services delivery, management, and planning. What are some of our HIT characteristics in our environment? And I know this can be said for a lot of different career paths or environments, but IT truly has never stopped, and really the pace has increased since COVID. It's just been a fast-paced, dynamic, ever-changing, and focused on whether it's regulatory or strategic planning, or needed for safety or quality purposes, ever changing, and we have to keep up with what the organization is trying to achieve and be there to support them. Key issues in healthcare, as you all know, there's high rapid rising cost, high variable clinical quality, patient safety issues, need for evidence-based decision-making, complex administrative processes, increasing consumerism and heightened expectations, advances in research and technology. And behind all of these, whether you're trying to deploy, enhance, initiate, or whatever phase of it you are in, technology is at the foundation of what you're trying to accomplish. So this illustrates a little bit of a balance of where we are with accessing and trying to utilize data. So there's this balance of trying to keep data safe, keep data secure, keep our eye on what is PHI data and what is confidential, versus allowing the right people to have access to the right data for analytics, whether it's for quality improvements, whether it's for patient safety improvement, for reporting to Medicare, whatever it is, for them to be able to do their job. So we constantly find ourselves in this opportunity to find the right balance of sharing the right amount of information out of the database to be able to accomplish the right amount of work in decision making. And it's just a conversation that's consistently, continuously ongoing. The challenge is establishing the mindset. So approach all of these with an optimization strategy. So at the bottom, we always want to find ways to improve clinical, financial, reporting analytics, or quality, or whatever it is, any kind of assessment. On top of that, we're always trying to put whatever you learn here, we want to improve the quality of care and the experience of the patient. And then on top of that as well, we got to find ways to continuously improve reimbursement, not just the dollars, but also the efficiency in which reimbursement happens, the timeline. Um, and no matter what, as important as quality is, we have to improve and work on reimbursement. We're not able to keep our doors open, as you know. And this is a little bit of an example of where we are and how we've evolved with information systems throughout the years. A lot of where we started with was some basic operations with EHR, revenue cycle, infrastructure, and believe it or not, even before that here, our ancillary systems were very well working with their own platforms, their own applications, but they were more siloed. So lab had their own lists, and radiology had their own radiology information system. Pharmacy had theirs. Ancillaries have been working on theirs forever. What EHR and some of the EMRs brought to light was bringing that platform together and trying to integrate some of it. So that there's a little bit more transparency across the workflow and the life cycle of the patient in-house. So next came the build of the system of care, so the HIE, pop health, analytics. So getting a little bit more into uh, facility to facility and keeping an eye on our patients and, as mentioned, population health, and then getting a little bit one step further where we still are and trying to find improvements is keeping our consumers engaged or our patients through the portal, and even more delight since COVID, telehealth and the mobile health type of facilities. This is just a little image to show as technology adoption has increased throughout the years. And again, I'll keep referring back to telehealth and during COVID, is that as technology advancement and adoption has improved, you'll see that transformation in healthcare delivery and population health has also increased and improved over time. They're very much correlated in their success. So the challenge, managing the IS investment. Competition for attention and resources with the following initiative and mandates. So like I said, there's a lot going on in an IS environment, and it takes the leaders in IS and the CIO effectively communicating to the other C-level individuals in an organization to communicate all the priorities and what's going on in an IS department. Keep in mind, IS is obviously not a money generating department, so it's hard to always attest or drive home the number of resources required. So having an IS strategic plan that marries up to a organization strategic plan and being able to clearly articulate the number of resources needed to make the strategic plan happen. Then under that, the operational plan happen is very effective when a CIO or a IS department is able to display that and communicate that effectively. Understand the following concepts as we go through these slides. There's some technology trends, the role and function of information technology in operations, factors of guiding the development of information services, including the planning processes, technology security requirements. We'll talk about HIPAA and government and organizational policies, health information, data equipment, interoperability standards, decision support, information system continuity like disaster planning, recovery backup, information systems planning and implementation, process for selecting an information system vendor, and the role of the CIO, the steering committee, and we'll cover some other roles that are very popular and obviously needed in the IS department. IS system or information systems planning. Begin with a strategic information system plan. Make sure that it's linked with the organizational strategic plan. It will not work well for any party involved in that organization if IS is working down a whole different pathway with their strategic plan than what the organization as a whole is trying to achieve. Treat information as an essential institutional resource that must be carefully managed. Instill a user-driven focus on IS planning and project development process. Create an information system steering committee for software selection, IS planning, and provide input on IS policies. Committee should be composed of administration, medical staff, super user CIO, and senior IS personnel. Committee should not be dominated by just people in the IS department. So what is the role of a CIO, the Chief Information Officer? He or she assures that and maintains the integrity and security of electronic data in a healthcare organization. They oversee management of all information systems and telecommunications. Some organizations have telecommunications actually fall under a different department, but we're just going to cover the 80-20 rule here. Develops the strategic IS plan, again, one that is aligned with the organizational strategic plan. Stay apprised of new technologies to secure data, negotiate vendor contracts, and being a member of the Information Systems Steering Committee. Other senior level roles in IT or HIT or healthcare information management professionals. So we talked a little bit about the Chief Information Officer. You might have also heard or have someone in your organization as a CTO, Chief Technology Officer. The CTO often focuses on strategic initiatives, while a CIO focuses on the operational. And not to say that the CIO is not involved with the strategic. They're very much involved in part of that decision making, but the CTO often works with the C-levels to go through that analysis of what is next and why. Then there's a Chief Security Officer. They focus on cybersecurity and risk areas. There's a Privacy Officer. Compliance, they work on compliance with privacy laws. And then you might have heard of these two roles as well, the Chief Medical Information or Informatics Officer, or the Chief Nursing Information Informatics Officer. The CMIO and the CINO often work in the IT department and act in their roles as the leader to liaison, communicate, and effectively acquire input from their peers for whether it's a special project or even day-to-day enhancement opportunities. I'm going to pause here for 1 second. IT department responsibilities. They exist of operations and technical support, application management, development and support, information security, network data center operations, database administration, website development at times, and telecommunications at times, and desktop support, your field services team. Components of the tech environment. There are 3 different high-level categories. They are applications or software. the software used by administrative clinical support staff to process and store data, manage patient records, and provide information. Your EMR, your revenue cycle applications, your scheduling, your those type of things, even your Office suite falls under your apps and software. Then you have your hardware, which are the actual servers, whether it's virtual or physical, network connections and devices used to access information. So your desktops, all of that type of hardware. Then it's the network, whether it's wired, wireless, that link the infrastructure together and enable accessibility of the application and the patient data. Clinical applications, the EHR is the electronic health record. It's the longitudinal record covering multiple settings over time. So the EHR functions, some of their functions include clinical documentation, whether it's by nursing or by providers, medication administration, electronic order entry, or CPOE, the computer. CPOE, the results management, electronic prescriptions, data from inpatient stays or outpatient testing, standards and interoperability, and outcomes reporting and decision support. Just a little bit of history here, evolution of electronic health records. In the 1960s, it started with El Camino Hospital, created a new and more effective method of tracking patient data. And then it led to the 1970s, where the VA implemented their Veterans Health Information System in technology architecture called VISTA. It was so well organized and it was so well adapted and easily accessible through all the different bases across the world, that in the 1980s there was a push where the PCs became a little bit more affordable, and the government made their architecture Vista open source and made it available to the public in the private public and private environments. And this kind of was the push and the initial opportunity where the vendors and different organizations were able to start creating and what we know as our EHR foundation today. What is an EHR function and what does it include? It houses our demographic information, the past medical history, creation and management of the problem list, medication list, allergy, and the patient orders. And from a result management, it typically interfaces with radiology lab and viewing and managing of the results. Clinical decision support systems uses EMR data to generate alerts and reminders to clinicians and care providers. Examples of these alerts are systems generate alerts during CPOE and e-prescribing. During CPOE, for example, if a provider is trying to order a chest X-ray and one was already ordered and has not been accomplished, it will give an alert of a duplicate order. It tries to let them know. E-prescribing, if they're trying to order something that a patient already has documented allergies to, it will give them an alert that this patient has allergies to whatever they might be trying to prescribe to the patient. These are just some basic examples. System generates alerts during radiology procedure that a patient is allergic to dye. During an outpatient visit, system reminds physician that patient needs a pneumonia vaccination. For chronic disease management, system generates a list of diabetic patients who have not had a retinal exam in the last 2 years. What are the 5 rights of CDS? Combine all the tools and types to strategically use CDS within an organization following a 5 rights framework. Who, what, when, where, and how. Emphasize the clear goals and objectives of all these 5 components, or else your organization providers and folks putting in orders will find themselves in an alert fatigue. When there are alerts just going off for every little thing, then people start ignoring them and overlooking them. So being strategic in what you're trying to alert or communicate will make the alerts that you're trying to create more effective to that provider population. Again, a little bit about the evolution of electronic health records. ONC continues to define the EHR system capabilities and certification program. To meet the capabilities defined by the ONC, EHR systems must have basic and advanced features, including data storage, secure accessibility, information retrieval, access to current clinical data, communication mechanisms to improve efficiency. They should also contain the following functions: demographic data, medication allergy, problem list, CPOE, CDSS, e-prescribing, HIE, and privacy and security capabilities. So when you review or identify a vendor that says they are EHR certified, they are saying that they have all of these basic functionalities. Continuing down the evolution of health, electronic health records, there's health information exchange, standards and interoperability, and patient engagement capability. So health information exchange is trying to identify ways that multiple or various EHRs are able to communicate specific information. And with that comes the standards. You're going to have standards so that the same information is able, so you're able to communicate those information across multiple platforms. And patient engagement is, again, back to our having our families and our patients, having the patients and their families engage in their own care and having access to that information through a portal, for example. National Standards for Health Information Technology. Standards support certification of electronic health records and the ability to capture and report data. This has evolved over time and is continuing to evolve. Critical to capturing and transmitting data effectively across institutions, across the state, nationally, and even internationally. Wouldn't it be great that if you had an emergency on your vacation in a different state, they were able to pull up some of your history. And we're not consistently there, but what's helping gap some of that, what's helping us with that gap is the fact that people that have access to their own portals and able to have that information when they are visiting other institutions has really been helpful. Now, information security. Hospital data breaches has increased nationwide in 2020, affecting around 26.4 million people in the US, according to a study. I'm going to pause here for 1 second. I'm sure, again, somebody else has mentioned this already, but please keep in mind when you're studying for this certification exam that anything on this exam from a current events perspective is a couple of years old. Tests are updated. These tests are updated every 2 to 4 years. And so whatever we're hearing real time on the news, or you might be reading in a journal, is not something, most likely will not be something you're going to be asked. So just keep in mind, a lot of current events will be a couple of years old on the examination. So continuing on this slide. So during this study, they found 6 key findings. Healthcare breaches increased 55% from 386 in 2019 to 599 in 2020. Just a point, since COVID has started, the number of cybersecurity and threats in a healthcare environment is at its highest levels ever, especially in the research areas. I think kind of quite evident or kind of obvious why, but any research entities and are at the highest risks for malicious attack currently. Hacking and IT incidents accounted for 67% of data security compromises in the healthcare sector. Unauthorized disclosures were the second most common type of breach, followed by loss or theft. The average healthcare firm took 236 days to recover from a breach. The average cost for a healthcare record breach increased from $429 to $499 in 2020. So costing the organization around $13.2 billion. 37 out of 50 states reported more breaches in 2020 than the previous year. HIPAA, the Health Insurance Portability, the Health Insurance Portability and Accountability Act of 1996. A major goal of the security rule is to protect the privacy of individuals' health information while allowing covered entities to adopt new technologies to improve the quality and efficiency of patient care. So HIPAA has 5 major rules. Privacy rule, PHI disclosure rules. Security rule, standards to safeguard PHI. Breach notification rule, 60 days to notify HHS. Omnibus rule, merges high-tech into HIPAA. Enforcement rule, how investigations are conducted. So I'm sure you all know, can't talk about information services or information technology without a little bit of project management. Some organizations have an entity project management department that focuses on facility growth or quality projects or other organizational initiatives. But often you will also find a PMO department or the project management or folks that wear that project management hat in the IS department as well. So a little bit information about project management. As you see here, the cycle from initiation, planning, executing, monitoring, controlling to the closing phase. Project management fundamentals. Project management is a formal discipline. It consists of planning, organizing, managing resources to reach the successful completion of specific goals and objectives. Often in an information systems department, the people that are engaged on these projects from a analytical, development, or application configuration perspective are the same people that are also supporting and managing the production or live or the environments that are already being utilized by the users in your organization. So it always comes back to effective management and communication between the project managers and the operational managers and directors, leaders, to effectively communicate what is being done by all of these resources and timelines and priorities so that they remain aligned. Just a little bit of project management terminology. A scheduled management plan is a document that contains information on how the schedule will be developed and controlled. Duration is a total number of work periods, as in days or weeks, that are required to complete a scheduled activity. Effort is the amount of work or labor hours necessary to actually perform a scheduled activity. Project schedule network diagrams are schematic depiction of scheduled activities and dependencies, which are logical relationships of activities. They model sequenced activities. A scheduled management plan, excuse me, this is a duplicate, my apologies. Activity relationships is diagramming technique that illustrates the activity's logical relationship. Finish to start, or start to start, finish to finish, and start to finish. Sometimes you can start a activity before you finish another. Sometimes you can't start the next one until that activity is complete. So it just depends on what activity you're doing and also the resources doing it. Schedule documents when the project activities will be completed. Critical path. Critical path is the longest path of activities through the schedule network. It establishes the earliest date by which a project can be completed. Float, sometimes referred to as slack, is the amount of time an activity can be delayed and not push back the early start of a successive activity. Scheduling tools. There are computerized project management softwares out there that help the project manager develop the schedule and provide information to manage the project. So a lot of these tools where you can put in how much a resource is really available, because they might only be available to do projects 30% of their time each week because they have other duties that they must also accomplish. So here's a couple of different further terms, but also concepts that are associated with project management. Post go live support. So you've worked on a project, you have deployed something, and now you're giving support to those individuals using that application or product. The goal of support is to ensure end user satisfaction, and you want to maximize the reliability and productivity of the product or application you have just deployed. A support team typically consists of super users. Who are super users? They are individuals that were pre-identified by either department or by user group, and they have received more training, a little bit more training, so that when you go live, they are also out there with more knowledge where they can help their peers. We typically have super users for nurses, secretaries, physicians, and different categories of the provider group, like surgeons or whether it's the hospitalist. We try to obtain super users so that if IS is not around 24/7, they also have people in their own group that they can reach out to for any type of assistance. There's the help desk. They are consist of application and operation team members. The network team, you might not always see them up front, but they are there behind the scenes to help and troubleshoot and support any issues that come up there. And then you have the workstation team, often with the field services, or client support team, which often also collaborate with the help desk team. Another category or term to get familiar with is the word upgrading or upgrade. Anytime you have something already being utilized, whether it's a EMR piece of software, Epic or Sonar, whatever you utilize, there are needs and opportunities to enhance features throughout the life stage of that product. Sometimes there might be something broken that's not working and they want to fix that. That is often called a fix or a hot fix. Then there's also things that or features that they want to improve upon because they've received feedback from their users and want to be able to take some of that feedback and actually put in their product. So factors to consider when planning an upgrade: there's new function, and then you have to determine, is there a need for training, or at a minimum, you want to be able to communicate that in um, in writing. There might be hardware network upgrades. There might be, and then with all that, like I said, you have to determine whether the upgrade affects the current users and the current functions, and whether you actually have to have in classroom training, or just FAQ one pager helps them understand, or what level of communication you have to make. Upgrades often have downtime, so you have to communicate and establish that in advance so that the users are prepared to utilize their downtime procedures. Um, and it might impact other organizations as well if another organization, another department is dependent on getting information or even utilizing your system, they need to know about it as well. So there's a structured approach to system upgrades. Use standard and approved processes, develop a test plan, test in the test environment, have some test cases and scenarios, test the workstations, and you want to have resources that might consist of your super users or others to be part of your testing resources to help you accomplish these tasks. Then you develop a detailed training plan, again, based on what features or functionalities are changing, and you update that documentation as well. So moving forward, when you have a product out there, something that IS does as one of their core activities is working with users, any of your end users, and working with vendors. So when working with users, and users are nursing, providers, the registration staff, even a volunteer at the front desk that might be utilizing your system. So listening, being responsive to their input, their feedback, their needs, and tracking and reporting issues. I'm sure in your department, you often hear the IS department ask you to put in tickets. Those tickets are just as important to us, just like receiving orders from a doctor prior to doing the lab draw. Tickets are what we work off of to execute on a need, but even more importantly is that these tickets help us track trends and track the issues so that we know, is there more than one person having this issue? Is there an issue with the system? Is this something that we can track and report on and tell the vendor that our users are having issues with? So we use these tickets for multiple means of reporting, and helps us behind the scenes to work with our vendor partners to hopefully try to enhance things that are collectively not working well in our organization. Now, working with vendors is maintaining a focus area, is to maintain a positive business relationship, to really treat our vendors as a team, as one of our team members, and ensuring vendors meet contractual obligations as well. So if you paid for something in your service level agreement or your service maintenance agreement, then making sure that they're held to that, and by doing that, effectively communicating your needs and expectations. So we talked about testing a little bit. So what's the importance of testing? Testing validates the system meets documented requirements, and anytime you're doing a install or an upgrade, a vendor will give you some foundational documentation, and you want to review that and confirm and see what it is actually doing in the system. It ensures or assures end users in clinical environment that the system is safe in a clinical setting, provides an opportunity to assess usability, reduces risk associated with poor end user satisfaction and poor performance, and builds confidence in the IT department. As I'm sure you all might have experienced maybe a IS or IT department deployment that might have not gone as ideal. Maybe the system provided some complications. And what we in IS would like to always aim for is to have those type of experiences to be minimal, because once you have those type of experiences, trying to re-engage with the user and have their confidence reestablished or improved upon with the IS department utilizing that product or other products is going to be harder to achieve. When somebody has a bad experience, even with, I don't know, even if it's with Excel or if it's with um, an app, once you have a bad experience with it, you remember that. So in IS, what we're always trying to achieve is try to work through the bug so that once it actually gets in the hands and fingertips of our users, it has already gone through and corrected some of those issues. There's type of testing. So going from the ground up, there's unit testing. So there's basic, very basic departmental workflow is what's captured in unit testing. Then there's integrated testing. Integrated testing includes sending and receiving information from other systems. For example, receiving the patient information from the registration system into the clinical system. That is an example of integrated testing. It's called ADT, Admit, Discharge, Transfer data. Then there's systems testing. Systems testing is testing the basic functionality of that system. Again, a lot of that you can get that information from your vendor, or what are some of the basic feature functionalities. Now, at a system integration testing, you're marrying those basic systems, feature functionality, and your integrated workflow in your organization. You're marrying that all up, and you're accomplishing that level of testing to see and confirm that product is working well in the workflow of your organization. Now, training, again, based on whether it's a simple upgrade or a complex upgrade or a simpler deployment or a very complex deployment with a lot of bells and whistles, you have to determine what all you are putting out there in that and the period of timing that you're doing it. You have to develop strategy for providing user testing, or excuse me, user training. There are different ways to do training. There's train the trainer. So you take a smaller group of people, you train them, then they become comfortable and confident in what they have just learned, and they turn around and teach another group of people. There's standard classroom style training. There's web-based training and one-on-one training. You do not often find one-on-one training because obviously there's just not enough people to go around to do that, but we often try to capture that during go live support, and we call it elbow to elbow support. But there are different types of training based on resources available in your organization, the dollars available in your organization, and also what you're actually trying to train on. So back to the plan, it's always very important, or a core foundation of successful training is identifying your super users. We talked about that earlier. And during the plan, identify your objectives, who will be trained, when, where, what are the educational materials that you will be creating so that they'll continue to have it for reference. And you need to have, from a technical perspective, a training environment so that they have training data to quote unquote play with and become familiar with those features. So training is critical to prevent medical error. You want them to already understand how to maneuver in the product before they actually are taking care of a patient. If larger implementation, develop a training plan that outlines user needs, training methodology. Add a design model, 5 stages: analysis, design, development, implementation, and evaluation. Customer service is a big part of what IS does. There's levels of customer support. There's help desk, and that's the first level. Monitor number of issues and number of calls where issue was resolved during the call, and they will utilize software for tracking issues. So back to IS will always ask you to put in a ticket. In the first level of support, they review what your needs are. They also look at trends. Is there one person calling about this issue? Are there 10 people calling in the last hour? Has there been 50 people calling in the last 2 weeks? They assess and analyze these tickets so that they can help give recommendations to IS leadership on needs that might have otherwise been missed. So if the IS first level support help desk is not able to resolve an issue, they will send it over to the second tier or second level, which is often your application support people. They troubleshoot the problem further. They have more access in the system from a build or configuration perspective. And if they are not able to resolve it, the third tier is often the vendor. Then they will open up a ticket with the vendor and work on whatever the issue may be. Statistics. According to the OCR, there were 477 healthcare breaches affecting millions of records. Now, we're going to be going back a little bit more into cybersecurity here. The largest reported data breach was less than 700,000 in 2017, a far cry from 2 breaches in 2016. Providers made a vast majority of OCR reports at 80%. Health plans represented 12. So a little bit of lead into our privacy, confidentiality, and security slides. Privacy. This refers to the right of an individual to be left alone and to keep his or her personal information secret. Confidentiality relates to sharing information with a focus on sharing information on a need-to-know basis. The patient may share information with the physician, but the physician must keep that information confidential. Security refers to the mechanism to assure the safety of data and system in which the data resides. So there are types of security. User security is the first one. It is the identification of system users and allowing access to the system by the appropriate user. Requires defined policies for passwords and which user role can access which function and data. So as you probably have experienced in a department, in an organization, not everybody has the same access into any system or product. It is often role-based security. Encryption. This is a communication that is unreadable to unauthorized viewers. Uses electronic public and private keys. The encryption scrambles the content until someone with the correct key opens it. You might often find that on a USB that is authorized to be used in a healthcare environment does have encryption on it, just as an example. Additional security measures that you might have already experienced in your organizations are password policies, password complexities, and often you're asking your organization based on your policy to change your password. It might be every 3 months or every 4 months or whatever your policy might be. Domain-based network environment, the domain-based world where a server manages users, devices, software, and domain policies. It manages all objects that are part of its domain and enforces rules on the network assets. So that is a way to securely and safely manage your network. There's HIPAA and risk analysis. HIPAA. So back to the HIPAA Act of 1996 and subsequent revisions. Title II of HIPAA contains 5 rules pertaining to administrative simplification and privacy and security. So know what a privacy rule is, security rule, transaction code set rule, unique identifier rule, and enforcement rule. What is PHI? All individually identified health information created, transmitted, received, or maintained by a healthcare institution. It's the identification of an individual, health condition, their treatment, provision, and payment for healthcare. All that information falls under PHI and something you don't want to access unless you are taking care of the patient. You do not want to talk about in a hallway or in an elevator with somebody, with even if it pertains to your role and you're talking to another person that should know it in a public area. You should always be aware of where you are and who can hear you when you're talking about PHI, even because it is part of what is needed for that patient. Examples of identifying information, all of these go back to PHI. Data integrity, requirements for maintaining data integrity, so during disaster recovery, and ensuring data validity. So we talked about role-based security just a moment ago. The job a user has will dictate what you have the right to access and to disclose. Only access information that is absolutely needed and that the user has the right to see. It's the minimum necessary, and authentication may include electronic signature required for a document. So as you see here, there's privileges in the system. Then it's a role-based security or access. And on top of that, you always have your policies that should reflect where these are and how they are handled. So some best practices: always use a strong password. Encryption of all PHI transmitted within the network and use of a VPN for remote access. Use of a standby mode when clinical users leave a screen with ePHI. Restricted download of aggregate patient data to end user devices, hard drives, flash drives, and other media. Use of an intrusion detection system, and proactive auditing. So disaster recovery. A disaster plan might include and often outlines how the system can be returning to an operating status in the event of a catastrophic failure. It can be complex in a large healthcare organization because of the number of individual systems, applications involved in that disaster. Change management and HIT system implementations. Change, as you all know, is often disruptive. Change in HIT systems come with unique challenges of its own. End user or executive resistance to change is one. Specialized resources needed for the change. Contention of or for current resources to manage current workload and actually implement the change. Requires formalized and complex planning. And with that, just what we just covered comes training and documentation. Requires effective and ongoing communication, not just within the IS department, but throughout the organization. Here, just a little image around change management, where on top, you might have project management from a technical perspective, but change management is more at the people level, so that you're able to communicate, articulate, document, and be able to set the expectations around whatever that change is and its current state, what transitioned, what changed, and what would be entailed in the future state. Because this could be technical, but a lot of this also impacts the daily workflow of whatever the change might have been. The people side of change management. This increases the urgency, build a guiding team. There should be in governments that reviews the changes so that the change is evaluated and assessed, and have the right vision for that committee, explain benefit and get buy-in from the decision makers, empower action, put the right team in place that represents the right departments and needs of the organization, implementation plan, the training plan, the support plan, create short-term wins and an effective communication plan, project milestones, successes, the benefits. Don't let up, make it stick. This is not something you do every quarter or once a year. This is something that you set up a cadence and continue to do that no matter what, and have backup so that when someone is out sick or someone is no longer in that position, the actual concept of this change management and this governance continues to move forward. HIT professional role in a quality culture. As you all know, we're always focused on how we can improve that quality for our patient care, and how IT plays into that. Provide the right information to users at the right time, provide the right amount of right information to the users, and provide the right information to users in the right place. You will often see that quality department and the IT department work very closely together. And there's a lot of training that goes on to offer quality department individuals with their own knowledge and access to be able to run reports, to be able to acquire the information they need to help drive enhancements in quality for the organization. Ethical duties for an HIT professional: represent credentials accurately, protect patient privacy, respect the patients, the employers, and the coworkers, and respond to unethical practices by others following processes and policies. So a little bit about study. Review the BOG examination reference manual. Take the time to review the entire document. Understand the key concepts we discussed and take the practice exam. During the exam, beware the governance section. Take your time reading the questions. Usually the answers could be possibilities that there are two answers that will seem like the best. There are typically two out of the four, there are two that will always be just wrong and more evident. And then out of the last two, you need to really focus and identify the one that is best complete or best answering the question at hand. Your challenge is to pick the answer that truly represents the concept in the question. Don't discount the value of your experience. Looking at this chart, you will see that healthcare technology and information management covers 9% of the exam, which entails 18 questions. So what not to do? This is not a college course where you can cram the night before and lose sleep. The night before your exam, please make sure to rest and get plenty of sleep, and create a study schedule, determine where you would like to take the exam, and then plan your timeline, which leads up to that date. Perform your own independent research, use authentic sources for your study materials, and as mentioned before, current events would be about 2 to 3 years ago based on the content of most of these exams. Create quality summary notes, study these notes over and over again. Write the content from memory into paper, and then compare these notes to the original. Determine which topic areas you are most comfortable with and which ones you want to brush up on. Answer as many practice questions you can and identify your areas of weakness. Focus on those. Decide how much time and effort you expend on studying each topic area based on the relative weight of the topic area. So a little bit more test taking tips here. Give yourself plenty of time to locate the testing facility. Arrive early to give yourself time to settle your nerves prior to the exam. Budget your time because you have 2 hours to complete. I'm actually going to remove that, but I will say, like I said, arrive early to settle your nerves prior to the exam. Read each question carefully, focusing on what is being asked. If you're uncertain about the answer, but nevertheless want to give a tentative answer at the time, mark the test question. You can literally mark it on the computer and to indicate that you want to review the test question and your answer if time allows. Go back to the questions marked in this manner after completing the entire test. And keep your eye on the clock. Ensure to answer any question. Don't leave anything blank because you are graded on correct answers and not anything wrong. So if you just guess, you still have a 25% chance of getting the answer correct. Read all options before selecting your answer. Always select the best choice. Do not overanalyze or try to read into a question. Questions are not written to be tricky. Do not assume additional information beyond what is given in the test question. All information necessary to answer the question will be given in the text or question or scenario. If there are questions including the words not, except, or at least, answer these with particular care because you'll be looking for the exception. Pay close attention to keywords such as best, most, primary, usually. These words indicate that other options may at times be correct, but given the word of situation in the test, you must judge which option is the best. When guessing or doing so by process of elimination, treat each option as a true or false statement and eliminate those that you would not select. Narrow your choices. The first time through the exam, mark an answer for every item. There is no penalty for guessing. Leave time at the end of the testing period to go back to the question you marked for review. If you're running out of time, leave a minute or so at the end to complete all the blank questions randomly. Remember, you have a probability answering a question correctly by chance, so don't miss any. So again, morning of the test, get a good breakfast, relax, and find your testing facility and show up. If there is a need for a calculator, there's a screen version available. And if there's anything on your mind or bothering you and you don't want to forget about it, when you get into the testing site, they usually give you a piece of paper and a pencil or something to write on. Write down all the things you need to remember before you start. Go through a test the first time answering all the questions, like I said, and leave the ones you don't know and come back to them. So a lot of times people ask, what do I need to pass? The minimum passing score and the minimum number of correct answers needed to pass the BOG exam. The score report indicates a pass or fail. The raw score or number of correct answers on the total exam determines a pass-fail status. Additional details provided in the form of a raw score by major content categories of the BOG exam content outline. There are different editions of the exam, which are equated to ensure that a candidate is not penalized for taking a slightly more difficult edition of the exam. Exams might have different minimum passing scores, but the equating procedure ensures that the level of candidate knowledge are equivalent across editions. What if I fail? How often can I take it? There is no limit to the number of times you may attempt the exam. However, each exam requires an application and a fee, and there is a wait period before the test can be retaken. And we will get with each other in a couple of weeks where we're going to have some direct Q&A. But here are some sample questions. An important management principle that should guide development of information system in healthcare category, or excuse me, in healthcare organization is to treat information as an essential organizational resource. One of the major elements of an information system strategic plan includes the, I'm going to give you time to read it, software development plan. Keep in mind that none of these would fall into a strategic plan. Okay, none of them would require any, none of the items require any type of plan. Selection of an information system in a healthcare organization should begin with what? Selection should begin with development of an information system plan that supports the organization's existing strategic objectives. A comprehensive information security policy would include all the following elements except, keyword except. Technical controls. It would include management policies, data backup and recovery, and physical security. In the IT system development lifecycle, which is the most important step? Most important step. It's system analysis. If you don't start with that system analysis and set up that foundation, then the design and what you acquire and how you implement, all that will not be aligned or correct. Again, thank you very much for your time and attention. Look forward to meeting you all in a couple of weeks, and good luck on your studies and on taking the exam.